Hello, class. Welcome to Flourish Nursing Academy. This is Tutor Godwin. We will be talking about the heart sound. Heart sound is an involuntary action. There are 4 heart sounds. Each corresponds to a particular event in the cardiac cycle. Lube. The first sound, fairly loud, occurs due to closure of the atrioventricular valve. DUP. The softer sound due to closure of the aortic and pulmonary valves. ECG. Electrocardiogram. It is the report of the electrical activity of the heart. The pattern of electrical activity may be displayed on an oscilloscope screen or traced on paper. The normal electrocardiogram, showing 5 waves by convention, has been named P, Q, R, S, and T. P wave. It arises when the impulse from the sinoatrial node sweeps over the atria, atrial depolarization. The QRS wave. It represents the very rapid spread of the impulse from the atrioventricular node through the A bundle and the Purkinje fibers, and the electrical activities of the ventricular muscle T wave. It represents the relaxation of the ventricular muscle. Ventricular repolarization. The electrocardiogram described above originated from the sinoatrial node and is known as sinus rhythm. P. Atrial contraction. QRS. Ventricular contraction. T. Ventricular relaxation. Cardiac output. The cardiac output is the amount of blood ejected from each ventricle every minute. The amount of blood expelled by each contraction of each ventricle is the stroke volume. Cardiac output is expressed in liters per minute. Cardiac output is equal to stroke volume over heartbeats. In a healthy adult heart at rest, the stroke volume is approximately 70 milliliters, and the minute heart rate is 72 milliliters per minute. Cardiac output will be 5 liters per minute. Factors affecting stroke volume includes 1. Venous return. 2. Strength of myocardial contraction. 3. Blood volume. Blood pressure. Blood pressure is the force that the blood exerts on the walls of the blood vessels. Blood pressure varies according to the times of the day, posture, gender, and age of the individual. Blood pressure equals systolic pressure over diastolic pressure. Systolic pressure. When the left ventricle contracts and pushes blood into the aorta, the pressure produced within the arterial system is called the systolic blood pressure. In adults, it will be 120 millimeters of mercury, or 16 kilopascal. Diastolic pressure. When complete cardiac diastole occurs, the heart is resting following the ejection of the blood. The pressure within the arteries is much lower, and is called diastolic blood pressure. In adults, it will be 8 millimeters of mercury, or 11 kilopascal. Blood pressure equals 120 millimeters of mercury over 80 millimeters of mercury. Blood pressure equals cardiac output plus peripheral resistance. Control of blood pressure. Blood pressure is controlled in 2 ways. 1. Short-term control, moment-to-moment basis, which mainly involves 1. Baroreceptor reflex. 2. Chemoreceptor reflex. 3. Higher centers in the brain. 2. Long-term control. It involves the regulation of blood by the kidneys and the renin-angiotensin-aldosterone system, ERAAS. 1. Short-term blood pressure. Regulation, cardiovascular center, CVC. It is a collection of interconnected nerve cells in the brain and is situated in the medulla and pons. Baroreceptors. These are nerve endings that change, stretch, within the arch of the aorta and in the carotid sinuses. These are the body's principal moment-to-moment regulatory mechanisms for controlling blood pressure. Chemoreceptors. These are the nerve endings situated in the carotid and aortic bodies. 1. Baroreceptors. When blood pressure increases, blood pressure more than 120 millimeters of mercury, stimulation of baroreceptors in the aorta sends the impulses into the cardiovascular center in the brain. The cardiovascular center stimulates the parasympathetic nervous system. Relaxation of the muscle of blood vessels, tunica media. Vasodilation and blood pressure will decrease chemoreceptors. When the carbon dioxide level increases and the oxygen level decreases in the bloodstream, it results in tissue hypoxia. Need to improve tissue perfusion. Blood pressure should increase in this situation, and chemoreceptors will recognize these changes in carbon dioxide and oxygen. In the bloodstream. Pass this contraction to the cardiovascular center in the brain. The cardiovascular center will stimulate the sympathetic nerve system. Vasoconstriction and blood pressure will increase. Now, let's explore more on the autonomic regulations. We'll delve deeper into the sympathetic and parasympathetic nervous systems and how they not only control blood pressure, but also influence heart rate, digestion, and respiratory rate. Sympathetic nervous system triggers your fight or flight response, gearing up the heart rate and redirecting blood towards the muscles for quick reactions. In contrast, the parasympathetic system promotes rest and digest, slowing things down, allowing for recovery and digestion. Imagine you're in a stressful situation. Your body needs heightened awareness, which is when the sympathetic system is at its peak. On the other hand, post-mealtime, when relaxation is key, the parasympathetic takes charge. Remember, these systems are constantly at work, balancing each other out. This balance is crucial for maintaining homeostasis in the body, ensuring we respond appropriately to different challenges and environments. Let's take a break from theory and reflect on how this knowledge applies in real life. As nurses, understanding these mechanisms enables you to monitor your patients better and anticipate their needs during sudden changes, like a panic attack or after an intense workout. So, in practical terms, knowing how to regulate these responses means managing patient recovery effectively after surgeries or stressful procedures, right? Absolutely. Every bit of this knowledge empowers you to make informed decisions, ensuring patient safety and comfort. Now, imagine you're in charge during a critical emergency. Your understanding of these systems could make all the difference.